Happy holidays everyone, welcome back to my YouTube channel. Today I'm here with Daisy, who's a medical psychologist who works here. She's going to introduce herself and tell us more about what they do at this facility. Daisy, welcome.
Thank you. So yes, my name is Daisy, as you've heard. I am a medical psychologist by profession. I work here at the Oasis Health Specialty Hospital. We are located on the Pony Road in Westlands area, a few kilometers, 2 or so from Westgate Supermarket. So we are an inpatient psychiatric facility or mental health facility. Inpatient to mean that if you need round-the-clock care by specialized nurses, that's what we provide here. So you can be admitted or you'll be given a bed and other services for you to get the care that you need. We treat various mental health conditions from mood disorders such as depression to schizophrenia to substance abuse and use disorders. And yeah, that's pretty much a very short description of who we are.
Okay, these are many medical terms, but we'll elaborate as we go along.
Yes, we will.
Just a quick one, how many years have you been in operation?
Okay, so this facility has been up and running since 2017.
Okay.
Yes.
Okay, since 2017.
Yeah.
So I'm sure many people also, they're lay people like us, like myself. Sometimes then people have not been able to, have not experienced mental health issues or anyone with mental health issues. But I think our society is getting to understand that mental health problems are diseases like any other disease.
Yes, they are.
But I would say from my perspective that there's a bit of stigma,
yes,
and people are usually afraid to talk about it or even to seek help,
yeah,
leave alone just to admit I have a problem and to seek help and go to a hospital. Because when you say a mental health hospital, we all associate it with Madare,
yeah,
people go there are crazy,
yes,
they wazimu, you know. So
yeah,
if you could kindly tell us, like, what are the kind of patients that you see? Like you said, you know, use bit words, describe to me, like, what are the kind of patients, what are your most common diagnosis that you see that someone somewhere who's maybe knows someone who's suffering from the same, or they themselves are suffering from the same, they can relate and say, okay, I think I can go there to seek help.
Yeah. So the kind of people we see is people like you and me.
I agree. Mental health does not choose guys, by
Exactly.
the way. Yeah.
Why? Because everyone has mental health.
As long as you have a brain, I think.
Yeah. As long as you have a brain, as long as you're a human being,
Yes,
you have mental health. So it is not respect of persons. Just because you have this or you come from this kind of family, or even if you don't have much, does not mean that you're not susceptible to mental health challenges. Yeah. One of the most common or the most common kind of cases we get are mainly challenges in the line of mood disorders, such as depression. That is simply when someone has excess feelings of sadness, someone who is hopeless, someone who is very irritable, someone who is very sensitive. That's just basically how depression presents. And people who struggle with various substance uses, use and abuse. So those are the, from the top of my head,
that's what
those
I think. Things like, for example, anxiety, bipolar conditions, like you said, schizophrenia. I'm trying to say ADHD.
Yes, ADHD.
There's another one.
There are many.
There's so many, a wide variety, but I'm just giving examples that, you know, people throw in ones outside there. So sometimes, and also when you talk about substance abuse, you're talking about alcohol abuse, drug abuse,
cannabis, especially among the youth. Cannabis,
which is weed.
Yeah, which
cannabis
is weed.
sativa. Is it cannabis sativa or cannabis what?
Cannabis.
I don't know the other one.
And then there is alcohol, obviously, and then there is cigarettes. Cigarettes, yeah, nicotine is a killer. Nicotine is very bad. Nicotine will kill you slowly. People don't really see like it's a problem, but nicotine will kill you. It will kill you slowly. Other substances like jaba.
What is jaba?
Jaba ni ile watu huko. Kama umeelewa jaba ni nini? Now, most likely you either use it or you know people who use it.
To be honest, I have mogoka.
Yeah.
Oh, no, you see now I've been addicted jab. Wait.
It's
so
jab.
You have to be conversant with this slang, these things on the street, the different services that come.
Yeah. But you know, I mean, even me, I was like, what is this? You know, it's only until when you get the patient and you're like, oh, Oh, that's what it is.
So you mean chewing mogoka can lead to a point where you can't do without it?
Yeah.
Okay.
It can.
Okay.
Yeah, because it is a drug, it is a stimulant.
Okay.
So yeah, it's a drug just like any other.
Okay.
So we do get people who chew mogoka and it's a problem. And we take them through addiction counseling and they get out of it.
They get out of it.
They do, yeah.
From your experience, from obviously working here and those many years you worked in mental health facilities, why do you think it's important to take care of our mental health?
Yeah, that's a very good question. Mental health is special. Mental health is not like physical health
Where we can see.
exactly. You don't know whether I take anything now. You don't know if I have a mental health condition. I mean, there are some cases that are quite extreme and you can tell, like maybe things like autistic spectrum disorders.
Okay, those ones there you could
You
tell
know, you
because
can
they have
tell-
social skill challenges.
Exactly.
Yeah.
You can tell this person is not, you know. But I mean, it's special in terms, it's not written here,
You can't know.
you know.
I usually say you sit with someone and you have no idea if they cry the whole night.
Yeah.
If for them to be able to come to work, they had to take 3 pills to concentrate, to
Oh,
be
yeah.
able to focus. You know, so
Oh,
it's,
yeah.
it's such an, you can't see it. And you
Yes.
can never know what someone is thinking in their heads.
Yes.
You just ask someone, are you okay? They say, I'm okay.
Yeah.
Then how?
Exactly. So it's very important to take care of your mental health because everyone has mental health and we are holistic human beings. To mean that if your mental health is not okay and every other aspect is kind of working, it still means that you're not well. Actually, that's the new definition of health according to the World Health Organization. That health is not just the absence of, you know, infirmity or physiological pain, but if your mental health is not in check, if something is wrong, then we are able to say that you're not healthy and you need to seek
Help.
help.
Yeah, it's
Yeah.
true because if you have any of those conditions you've mentioned, then it affects your health. It affects your immunity, it affects your productivity, it affects your efficiency. So you can't say you're okay.
Yeah.
There's no way you can say you're okay.
There's no
So,
way.
like you said, it's a holistic. It's
Yeah.
a holistic look view of the human person where you need to take care of your mind, your body, your spirit, everything.
Your
Just the way-
spirit,
yes.
yeah.
Yeah, your
Yeah.
spirit, it's part of it.
Yeah.
Just the way I exercise, I eat healthy, then I have, my mind has to be healthy to feed it healthy things.
Yeah.
Okay.
Actually, what we use here at Oasis is what we call the biopsychosocial model. Biological, psychological, biopsychosocial, social model. So looking at an individual holistically, your body, your social aspects,
Your
your
environment.
spirituality, yeah, your mental health, everything that we look
The
at.
company you keep,
Exactly.
what you surround yourself
Yes.
with, what you eat,
Yes.
your habits,
Yes.
your routines.
Yeah, yeah.
Wow.
That's the beauty.
I
of,
think we all need a
Oasis.
session.
Yeah. Yeah,
Yeah.
that's true.
I know that there are many mental health challenges and many mental health issues and diseases, but how would someone be able to identify or be able to come to the conclusion, okay, let's not talk about Google, just in general, how someone can be able to identify, I have a mental health challenge or I have a mental health condition, I'm struggling with something, because I think that's the first step
Yeah.
before you come to seek help,
Yeah.
or you tell the people around you, I would like to seek help.
I think basically it's just taking a self-inventory. That is having a meeting with yourself.
Unajita mkutano.
Yeah, you unajita mkutano. And most of the time you just feel like there's something wrong. You know, everyone it's very subjective to me that it's
Yes,
very,
it's very subjective, yes.
individualistic, yeah. So probably you just feel like there's something wrong. Maybe you're not sleeping well, or maybe you naona these days, you know, you're crying a lot more than usual, or you have this thing of you unastuka sana, or you feel like you cannot breathe. I mean,
You panic attacks.
yeah, those are panic attacks, you know. You'll just feel like there's something not right. Maybe you won't understand. Sometimes it comes, sometimes it doesn't come. It's possible kusikia kama ujielewi. So once you feel like that, it's okay. You can
come and you can see something.
Exactly.
Yeah,
We also have a mental health app that we are going to launch very soon.
Interesting.
Yeah.
A mental health app.
Yes,
Interesting.
an Oasis app where you can take tests if you feel like you have this depression, take the test on the application. If it comes out positive,
then you'll be able to take the next step.
Exactly, which is find your way down here to see a psychologist or a doctor, or speak to a psychologist immediately.
Okay. Yeah. I think that app is a good idea, especially for someone like me who has children, who's a parent.
Yes.
Sometimes in the world we live in, you have Google, who's the teacher, the doctor, who's everything. So because of the stigma around mental health, it becomes very difficult to speak or talk to someone about it. So you find you tend to go to Google, diagnose yourself, start treating yourself with over-the-counter medicine. It could be a misdiagnosis. It even couldn't be what you're thinking. It could be something that is easily solvable in a few sessions of therapy or a few days of medicine. So I would like the idea of the app because you're able to log in. The app is backed by medical professionals who actually know what they are doing. So I'm not just going to Mr. Google. I'm not saying Google doesn't work. But when it comes to our mental health, I feel like we need to let the specialist take charge. Because sometimes you can misdiagnose yourself and start taking drugs that are not necessarily treating your problem and aggravating it to make it worse. So guys, when the app is going to be out, I'll let you know, and I can't wait. I'll be the first one to take the app, guys. Don't think like we need to be able to accept that, like you said, it is a respecter of
no persons.
No persons. So okay, that's also, I've also experienced as a mom, sometimes you find, like you said, you're not following your routine, you're sleeping more, you're lazy, you have no motivation, you don't want to see your friends, you isolate yourself. I was just telling her about isolation, but it happens to all of us. Even now, sometimes when you're going through a difficult time in life, you find you ignore your friends' calls. You say, I'm busy, booked. So when you continuously do that over time.
But you see, it should end. It should not be prolonged. You see, there are ups and downs in life. But an individual who has an underlying condition, it's like it doesn't end, or they find themselves in a circle. It's something we're calling a vicious cycle, or what is not such a big deal to someone else is such a big deal to you, and you become almost overly affected.
Even overly sensitive. I say
exactly.
Overly angry, irritable.
Exactly.
You wonder. So she's right, like we have up and downs and struggles in life, so she's not mentioning those once in a while because life does happen. But if you have a continuous cycle, then you need to seek help. So Dr. what are the age ranges of your patients? Do you see young kids or do you see adults? What are your age ranges?
We see, even adolescents to whatever age. Okay, so you are able to teach them from adolescent. Okay. And when it comes to, as a doctor, what have you seen over the years in terms of society accepting mental health challenges and being able to seek help? Be honest. Be honest. A society, meaning all of us, me, you, everyone. Because like I said in the beginning, I didn't grow up knowing these things, knowing that people had mental health challenges. I've just learned them now. I'm older, now that I'm a parent, now that I have kids, now that I've also opened up my mind and said, okay, this thing is real. So what has been your experience over the years? I think a few years back it was not a very open subject to talk about, but now people are becoming a bit more aware, a bit more accepting. There's also a lot happening in terms of creating awareness. There's no need to hide your person.
It's a disease like any other.
And it's not a respect of persons.
It's not a respect of persons.
The myths are beginning to become demystified. Like maybe one of the most common African myths is umerogwa.
Umerogwa, you're right.
Exactly. And that's quite stigmatizing because by the time someone tells me you're near watu wa kwenu, already you're looking down upon yourself, your family.
Whatever fate the rest had, I'll wait for that fate. So you don't feel that motivation. No one is telling you, giving you that it can be dealt with.
It can be dealt with. So there's no need to hide your people. It's a condition just like any other. The same way you can be diagnosed with diabetes or
high blood pressure,
or hypertension, and you take medicine. And for some conditions in the mental health field, you will be on medication for quite a long time. It's the same thing as that.
Yes, you have to take your medicine, like we're talking about it. You know, you can't say, oh, today my sugar level is okay, I will not take my diabetic medicine.
Exactly.
You have to continue. It's tiring, yes, but you have to continually take it.
Yeah.
You have to embrace a change of lifestyle.
Yeah.
You have to have another level of self-awareness.
Yes.
So it's a condition like any other condition.
Yes, it is. Yeah. So like that aspect of it being tiring, that's why we are here as a hospital to provide support. We understand that when someone has a chronic condition and you have to take medicine every day, it can be tiring.
It is.
You know, especially if someone doesn't have, like they have not accepted fully that this is a problem that they have. Just come down here, we talk about it. Do you know even just one therapy session can help?
Oh, it does make a big difference.
Just one.
Yeah.
You don't have to go through the whole process. Just coming from one therapy session, talking to a professional,
understanding yourself better. And finally, I know what I'm suffering from.
Yes.
You know, there's nothing as frustrating as not being able to understand yourself. The people around you don't understand you. So now we are all lost, So we're operating on frustration, on getting tired of each other. We are fighting. So once you understand, what am I suffering from? How can I, and the thing I like about you said about talking and therapy is that other than sometimes some condition might require drugs, I know that you also really, you also focus and put time in someone being able to find coping skill, coping mechanism, understanding themselves, what triggers them.
That's actually what we do here at Oasis, and it's done by various professionals. So there are psychologists on board like me who take people through psychotherapy to help them understand, okay, so there's stress in life, but how do we cope better with it? Especially because we know that there's an underlying problem. Let's just say the most common thing is depression.
Yes.
First of all, what are your warning signs? What things do you start experiencing for us to know that probably you're not in a good headspace?
I am dipping. I am sinking.
Yeah, how you need to identify those things that create self-awareness. Then there are coping skills. So what can I do differently to go through a challenging situation
and be able to manage it better than last time?
Exactly.
It doesn't mean that it won't affect you.
Exactly.
But the point is, am I managing it better than last time?
Yes.
So meaning I am gaining coping skills.
Yes. Yeah. Then we have something called occupational therapy here at the facility by one of our occupational therapists. She's the head of that department. What she does is she engages people in activities to promote what we call activities of daily living. You had mentioned something about how when someone is doing very badly, you can start seeing they're not showering anymore.
They stop taking care of themselves, they stop going to the gym, they're not eating healthy, they're neglecting. You know, things they used to enjoy before, they are not doing it anymore.
Exactly.
For me, that's a very big sign. As a mom, that's a very big sign to look out for.
Exactly. So what this occupational therapy does is she engages those patients using activities to help promote those activities of daily living. Activities of daily living are simple things like, are you able to brush your teeth? Are you able to make your bed? Are you able to socialize with people? Because human beings are social.
Yeah, well, we're social beings.
Exactly. So what she does is she uses activities, in short, games. When you come to Oasis, there's no time, you'll not find the patients engaged.
I've just seen them, others are doing art.
Exactly. Our walls are full of what previous patients have done. And that, can you imagine, promotes that. It promotes social skills because we are a very family-oriented hospital. The chances are very low that you come to Oasis and you will not find a friend. The chances are very low you'll feel isolated. Somehow we are able to promote that feeling of oneness. So when people come, we do group activities, a lot of group activities, playing games, things like Monopoly, things like chess, things like Ludo, cards, playing outside at the basketball area. We have a table tennis court. I mean, that's one of the special things about Oasis. We have an occupational therapist who promotes activities of daily living, and I mean, once you come here, you begin to understand, wow, so I can actually function. And there are so many people who are just like me,
and I like the fact that, you know, I've come maybe here and I wasn't able to achieve much or able to complete maybe a task, and then I come here and let's say I draw a picture, I color it. I'm
Yeah.
proud of myself.
Yes.
I start regaining my confidence.
Exactly.
Then imagine I can achieve something.
Imagine.
I'm slowly starting to get back to being productive.
Yeah.
So someone might see it's a small thing.
Yeah.
But from someone who's coming from a dark place,
Yeah.
I'm able, slowly by slowly, I'm able, then if I can draw a whole picture, paint, what about tomorrow if I can wash my clothes?
Yeah.
What about tomorrow if I can cook food?
Exactly.
So you see those small steps. So then when
Yes.
they go back to real life, they're able to pick up again.
Yeah,
It's
because
interesting.
now you're motivated. You're like, wow, yesterday I did this. It's up on the wall. Tomorrow I can do something else. So, I mean, holistic care. We give patients holistic care. There's a doctor who gives medication if need be. There is a psychologist who takes them through talk therapy. Then there is an occupational therapist. There are the nurses who provide a lot of support and friendship also, just talking to people, and medication, giving of medication, making sure everyone is okay. They are very good at that. Then you have the kitchen who make amazing meals.
Because also you have to give them a balance.
You do.
Because also, like you said, it's holistic. When you're going through, just the same way, you cannot be suffering from diabetes and I'm taking Coke.
Yeah.
So even if I'm suffering from a mental health, let's say I'm suffering from a hyperactivity,
Yeah.
and then I go eat food filled with sugar and fat, then I'm not supporting my condition and my process of coping and trying to understand myself.
Exactly.
So I like the fact you mentioned the food, because I'm sure food plays a big role
Nutrition,
in different conditions.
It does. Like for example, I don't know if people know this, but you know when you have anxiety and you take a lot of coffee, it doesn't help.
Coffee, Red Bull, let me just say it,
Energy
guys.
drinks.
Energy, coffee, Red Bull, Monster.
Yeah.
I really, like, there's one thing I do not like buying is those things, because sometimes you find it just adds the anxiety.
It does. It makes you feel more
Antsy.
apprehensive. Antsy, exactly.
Yeah.
So, I mean, because we have a wonderful team
That understands that.
yeah, you
So they
receive
provide-
proper care.
You provide, no, it's holistic, so we
Yes.
have all that.
Yeah.
Okay.
Yeah,
Okay.
we do.
And what is the average? I know everyone is different, and every condition is individual to that person, the patient. So, and I'm sure you tailor-make the treatment to an individual needs.
Yes.
But what is normally the days that people stay in? Because when it's inpatient, is it 30 days, 60 days, or it depends on your condition?
It is very, you know, the thing about Oasis is that it is patient-centered. It is completely patient-centered. We will listen to your case and we will tailor fit a treatment plan according to exactly what you need.
To you as an individual.
Exactly. So, believe it or not, there are some people who just need to be here for 2 nights.
I believe it. I've seen it.
Yeah.
So I believe it.
Yes. There are people who just need to be here for 2 nights. And it's okay because maybe
You need to calm your thoughts.
you need to just get a moment of calm.
And we go through the coping mechanisms.
Exactly.
We remind you what to do.
Exactly.
Yeah.
Just have a small conversation and after that you're okay. But there are other individuals who need to stay here for at least 3 months.
Which is fine.
Exactly. People who have, I mean, most common thing, substance use disorders, need to go through the whole rehabilitation process.
Okay.
That does not take less than 3 months.
3 months. Okay.
But again, at Oasis, we are very patient-centered. We will listen. You know, sometimes people fear that nikikuja
Nikiingia mtanifungia,
Hapana.
sitaona watu wetu.
Hatutawafungia.
Yeah, you allow visitors.
Yes, we do. I mean, remember, we are also very cautious of what is happening around the world, the pandemic. So, I mean, if we start to see that, okay, maybe the patients are taken care of, we need to kind of re-strategize, we'll do it.
Yes.
But remember, it's all for the benefit of the client.
Yes, but what I mean, for example, you have your child here, you have your person here. If you organize a visit and the doctor says they're ready to visit and they know that you're a positive influence.
Yes.
Because sometimes you just have to be careful. Is it a positive influence? Are they coming to bring the jabber, the things that you do, the things that so I also understand those dynamics, but what I want to just communicate is that when the visits are allowed and when the visits are permitted, and you're in a stable mind, you're allowed to visit.
Oh yeah.
So it's not a jail. That's what
it's
I want
not a jail.
Yeah.
I mean, we don't even wear uniform.
No, I'm saying you don't.
Let's start there. You know why? Because it's a home away from home. You know, the environment is beautiful. The environment is beautiful. It's calm. It's in Nairobi, but a bit far from the hustle and bustle. It's in a place where if you need just a moment, people like to say, I just need a moment. If you need just a moment.
Just a moment. I've learned a new phrase, just a moment.
Yeah, if you need just a moment, I think Oasis is the best place for you to be. A place of recuperation, a place of healing,
Calmness.
a place of calmness.
I know you talked about the different services you offer. Do you have packages?
Yeah.
Would you maybe speak a little bit about them? I know you can't speak about everything, but what is usually your common on top of your head, the different packages you offer?
Yeah, we offer rehabilitative services, which is, treating individuals for substance use. So usually for detox, if someone needs detox, it doesn't take less than 7 to 10 days.
Okay.
Then from there we can reevaluate.
Okay.
You need to go through the whole process of rehabilitation. That's 3 months. We can talk about a package when you come and discuss that with you. Or do you need to maybe engage in something else? Maybe the underlying condition is what is precipitating
the addiction.
Exactly. So you need to go through that process. Services, we have rehabilitation the services for 3 months according to our assessment. Then there's that for 7 to 10 days for detoxification. We have psychotherapy services. Again, very subjective and patient oriented. For example, if it's me, you come, we'll have one session and I'm able to see you need 6 to 12, or you
psychotherapy
need...
is what people call counseling.
Counseling,
yes.
Sorry. I should not assume.
Counseling. So you have that for outpatient.
For outpatient.
So I can come and see you and you book dates and I come see you and I leave. I don't have to stay.
Exactly. Yeah, so that is outpatient, psychotherapy services, counseling services for whatever issues you're going through. Then we have services like kukuja kuona daktari. This mental health thing, sometimes you need medicine.
Okay.
For example, if you're not sleeping, you are not showering, you are not motivated, you have no energy, you are not eating, you're seeing things, you're hearing things, you need medicine. Okay. So you need to see a psychiatrist.
So that you get a diagnosis.
Exactly.
And now you start on a treatment plan.
A treatment plan.
Okay.
So usually what happens is probably you'll see the doctor first, they give you a diagnosis. Then you are now taken either to see the counselor, the psychologist, to do the sessions. And then we also have the occupational therapy I was talking about, especially for individuals who have, they lack social skills and not able to take care of themselves. Even for this thing we're calling schizophrenia. This thing we're calling schizophrenia is wakati unaona mtu, they are having bizarre behavior. They are not behaving the way me and you can behave. Saa zingine mtu anatoa nguo peke yake. Exactly. Saa zingine anatoa tu nguo ama anajiongelesha mahali.
Ama unaona kama kuna watu wengine anaongea na.
Unaona huyu anajiongelesha. Unaona ama unaona ni kama anaona vitu zake. That is something
you need to seek attention.
You need to seek attention, you know. And I've seen occupational therapy helps because people like that have what we are calling disorganized thoughts. So unaona hata ukimongelesha you are not making a lot of sense. We are not making a lot of sense.
Those terms because of the terms people use. And then we laugh about it.
Au
anakuaga tu hivyo. And then some people say anakuaga na watu watatu kwa kichwa. It's not something that you should take as normal,
lightly,
and take lightly. Seek help.
So occupational therapy helps that. Those exercises for we are playing this game, we are doing this, it helps them put things together. That's another service we offer.
Good.
We have nursing care, outpatient and inpatient. Outpatient, if you come and maybe you're feeling a bit anxious and you need somewhere to lie down, the nurse will take care of you.
Oh, wow.
Yeah, okay. The nurse will take care of you.
I didn't know that.
Inpatient, obviously, if you're sleeping here, the nurse will give you the medicine. The nurse will bring you food if you need to be brought for food if you're not able, but we encourage you to do it yourself.
Try and do those small things.
Exactly. They will change your beddings. They will make sure everything is okay. If you feel, the doctor is not here 24/7.
No, it's not.
So if there's a problem during the day, they will call the doctor and get an instruction. Maybe you need some medication. Maybe the doctor will say, okay, let her do some therapy or talk to someone and see if that helps. The nursing staff are very hands-on and very important. Then we have obviously the kitchen facilities. We have the our claims officer, who is very good when it comes to payment and discussions.
Before you even go to payments, let me just, before you even go there, we or the society, there's a general idea that mental health facilities are very expensive. And people think it's a lot of money. Hey, Mr. Peleka mtu wangu, nitapata pesa, nitatoa hiyo pesa yote wapi? First of all, I just like to say it's a disease like any other disease.
Yeah.
If you're home suffering from malaria, you look for the money to go to hospital. So our first step is to accept that mental health challenges are diseases that can be cured. So that's number one. So we need to be able to go to that pocket, remove money to go and get it treated. Yeah. Number two, I'd also like Daisy to talk about the different payment options and ways someone can seek help and be able to afford the services.
So believe it or not, guys, there are very many ways, like insurance.
If you have a health insurance.
Yes. Common insurance companies like Britam,
Jubilee,
exactly,
CIC,
Minet, all those, you know. We have also corporates like KCB, University of Nairobi, Kenyatta University, we have Bupa, we have Cigna,
we have Aetna.
Exactly. There are so many. Like, I cannot even tell you all of, but there are so many. The probability of you coming and us not having it is very low. And then we have NHIF. NHIF,
guys, which everyone should basically have as long as you're above 18.
Exactly. We do have NHIF. Certain job groups like policemen are very welcome here. You know, people don't know it, but policemen they can really struggle.
It's a very traumatic job, guys. You went to Kiganja to learn how to be a police, but no one prepared you when you come face to face to an accident, with an accident scene, and see all the blood. There's a lot of trauma in their job.
Exactly.
Yeah, so we need to understand that. Their job like also police,
the
army, nurses, counselors like yourself, psychologists like yourself.
So we do take NHIF, and the schemes are many. I wouldn't be able to completely exhaust all of them. So don't suffer in silence. Come down with the card. Let's see what we can do for you.
Exactly.
Again, we are very customer friendly. So there's no way you're going to come or make a phone call and you're going to turn your way. Just say what kind of service you want,
and we can give you options.
And we can give you the options. I won't be able to say all of them.
I know, but just for me, I wanted to just demystify the fact that it's very expensive. It's not, guys, and it's not like I've not sick about myself. So I know that these hospitals do cater for it. And sometimes, like we were talking about, we were saying earlier, information is power. You know, you need to research. Call your insurance, do you offer 1, 2, 3, and you'll be shocked that they will. Sometimes even just going to your employer and be like, I'm suffering from this and this. Could you kindly assist me? They will. But kama ujisemi, hakuna mtu atakusaidia. You know. So guys, I want Tari to elaborate about the NHIF card. There's a lot about it, so just clarify, because someone just does, you say NHIF, someone does not understand what that card can do for them. What the NHIF card offers in terms of mental health facilities or the amount of money you're entitled to.
So you'll allow me to read. So there's something we're calling managed scheme. This is for civil servants within job group L to T. Outpatient is not, there's no limit.
There's no limit outpatient.
There's no limit.
They can come for therapy, they can come to the doctor, diagnosis.
You can come and get whatever it is that you need, and you'll be given, there's no limit.
For job group L to T.
Exactly, for outpatient. Then for inpatient, you can also come.
Is there a limit for inpatient?
I think there's a limit for inpatient.
But at least you have money to start with.
Exactly, especially for outpatient. Because most of the time, maybe this job group are not very susceptible to getting conditions that would lead them to be admitted. So the outpatient is very, very helpful. Then we have civil servants, job group A to K. You have outpatient services and inpatient services. Both, I think, are limited, but it's enough. It can cover you.
It can cover.
Well.
In short, don't suffer in silence, guys. These are options.
There is no need. Then we have what we call fixed fee for service. This is job group F to K. These are people like who we're talking about, like the police officers, prison officers, people within that job group. Do you know that if you come to Oasis, especially for rehabilitative services, inpatient is unlimited.
Free of charge?
Yeah.
Wow.
So you don't pay anything.
So you don't need to suffer with trauma.
Exactly. And you see, we're talking about policemen and people who work in such...
Prison officers.
Exactly. People who work in such triggering environments.
Very triggering.
It is not uncommon for us to hear that, huyu anakunywa sana.
Na huyu alichukua gun akajishoot.
Exactly.
Ama anavuta bangi sana.
Anavuta. Can you imagine, you can come to Oasis, get the treatment, the full 90 days. You'll not
without
pay
paying
anything.
a cent.
NHF will cover it for you.
Wow.
To the maximum. Okay? So that's the fixed fee for service. Then there's a national scheme, which is...
Now me and you,
exactly,
like Sisi.
Yeah. You're given 60,000 shillings per annum. And
per year.
Per year. Then after the 60,000, you need to top up.
Yeah. But that is a start. It helps you to come and start and seek help.
Yes, it does. Yeah.
So okay. It's good to know the NHIF has covered me. Thank you, the government.
Yeah.
So people, it's important to pay that. It's important to have an NHIF card, please.
Oh yeah.
Please.
Yeah. Very important.
Okay.
Yeah.
So guys, I've learned a lot from this session from Daktari. Obviously, there are so many mental health challenges and problems that we can't discuss here.
Yeah.
We'll definitely have sessions in the new year where we can pick different mental health challenges, maybe bipolar, anxiety, depression, and maybe delve deeper into it. How would you know you're suffering from it, symptoms, how to treat it, coping mechanisms. But for today, we just wanted to let you know that Oasis Health Specialty Hospital is here. You can come see them, let you know the options that they offer in terms of payment, the kind of services they offer, the kind of professionals you'll find here. And like you had, they are friendly, family-oriented environment. And to be honest, I have seen people who've come here and they have been able to seek help. And they are out there with us, living normal lives like us.
Yeah.
And again, we remind you, mental health is not a respect of persons. You can also have from it. Children, adults, parents, no one is spared. Just so don't suffer alone, like I said, do not suffer in silence. That's my parting shot. Actually, what is your parting shot?
My parting shot is you can find us on our social media handles. We are on Instagram and Facebook, and we have a website. So for the handles, you just look for Oasis Health Specialty Hospital, and you find us there. You can DM us, you can send us messages on Facebook, you can email us on the website. There are phone numbers there that you can call, which are active 24 hours.
24 hours.
24 hours. You can call the numbers and talk to a healthcare professional, and they can help you navigate what it is you want to do
and what you're going through.
Exactly. If you don't know that you should see a psychologist or a doctor, we'll help you.
That's why they are here.
Exactly.
To help you, and they're here to walk. What I like about you as an student, you're here to walk the journey with me.
Yeah.
You're not going to diagnose me and then buy or give up on me. And that's what I like, the idea of the treatment plan. And I can't wait for their app. I told you I'll be the first person to use it. So when the app comes out, I will let you guys know, and we'll obviously do tests on it and spread the word. Other than that, guys, I wish you happy holidays. And like the child said, mental health is important.
There is no health without mental health. Take care of yourself.
Thank you, Dad. Thank you.